board that helps health professionals to bring balancing training to the next level. Phybit is a balance board work embedded with ARM-based microcontroller, high-accuracy 6DoF motion sensor, wireless Bluetooth connectivity for smart devices. It comes with a rechargeable battery over 6 hours of continuous usage. It is portable, compact, and robust.
CR2 Haptic is a compact and portable rehabilitation robot, which provides exercise training for forearm and wrist movement. The robot will provide assistance to assist the movement when it is needed and resistance to strengthen the muscle when users start to improve. The device can be used by elderly people, stroke survivors, and others who need rehabilitation training or exercises for the hand. It also provides customizable training therapy to fit for different user performance. The robot encourages and motivates the user to perform more training by providing various engaging virtual reality games for them to play while training their hand. The compact design of the robot provides optional modular units that can be used to train for different functional movement in limited space to fit for various users. The robot also provides an assessment program for evaluation of hand movement in terms of a movement range, strength level and game performance, which can be used in the therapy assessment process. The assessment result will be recorded in a report, enabling users to review their progress over time.
Balance board that helps health professionals to bring balancing training to the next level. Phybit is a balance board work embedded with ARM-based microcontroller, high-accuracy 6DoF motion sensor, wireless Bluetooth connectivity for smart devices. It comes with a rechargeable battery over 6 hours of continuous usage. It is portable, compact, and robust.
CR2 Haptic is a compact and portable rehabilitation robot, which provides exercise training for forearm and wrist movement. The robot will provide assistance to assist the movement when it is needed and resistance to strengthen the muscle when users start to improve. The device can be used by elderly people, stroke survivors, and others who need rehabilitation training or exercises for the hand. It also provides customizable training therapy to fit for different user performance. The robot encourages and motivates the user to perform more training by providing various engaging virtual reality games for them to play while training their hand. The compact design of the robot provides optional modular units that can be used to train for different functional movement in limited space to fit for various users. The robot also provides an assessment program for evaluation of hand movement in terms of a movement range, strength level and game performance, which can be used in the therapy assessment process. The assessment result will be recorded in a report, enabling users to review their progress over time.
smart balance board that helps health professionals to bring balancing training to the next level. Phybit is a balance board work embedded with ARM-based microcontroller, high-accuracy 6 DOF motion sensor, wireless Bluetooth connectivity for smart devices. It comes with a rechargeable battery over 6 hours of continuous usage. It is portable, compact, and robust.
CR2 Haptic is a compact and portable rehabilitation robot, which provides exercise training for forearm and wrist movement. The robot will provide assistance to assist the movement when it is needed and resistance to strengthen the muscle when users start to improve. The device can be used by elderly people, stroke survivors, and others who need rehabilitation training or exercises for the hand. It also provides customizable training therapy to fit for different user performance. The robot encourages and motivates the user to perform more training by providing various engaging virtual reality games for them to play while training their hand. The compact design of the robot provides optional modular units that can be used to train for different functional movement and limited.
Hello, everyone. A very good afternoon to all. Thank you for joining us today, and we will start now. So a quick introduction about myself. This is Khor here. I would like to welcome everyone here today to join the webinar today, the title of how to prevent and treat shoulder subluxation after stroke. So I myself is in the field of stroke rehab in the past few years, and today we realized that shoulder subluxation is one of the challenging situation commonly faced by patients, and that's why we have our speaker today. I would like to introduce Yvonne. Yvonne, are you here today? Can you turn on your camera? Hi. Hi, Yvonne. Can you hear me?
Yes, I can hear you.
Great. So thank you for joining us today, Yvonne. And right, so I just do a quick introduction about Yvonne. So Yvonne is a senior physiotherapist he founded YK Natural Physio Academy. So she have 8 years of experience in the field, helping patients in Parkinson, neurology, stroke cases, sport injury, and etc. So he has some experience in treating different kinds of patients from 6 different countries. So she also have actively using different kinds of latest technology as well in his practice, how to help the patient with his practice. And more importantly, comes to know Yvonne, I think in the past few years, Yvonne is a very passionate therapist. I always ask her, hey, Yvonne, I know physio is not an easy work. Why you still maintaining for after 8 years in this field? And she always tell me that she feel the accomplishment of helping patients, reducing their pain and getting back their life that they want. And he feel that there is a passion, give her the motivation to continue. So without further ado, I would like to, just a quick one. So during the session, we will be kindly turn off your mic. Okay, and we will be having our 20 minutes of Yvonne later will have a 20 minutes of presentation related of this topic. So she will share about shoulder subluxation topics and some of the suggestions. And then we also have 30 minutes of Q&A session where we will have more engaging movement conversation today. You can feel free to drop your question in your chat box, in the Zoom session. And also if you are coming from live, you can drop your question in the our Facebook there. So today, I think we get quite a number of participants. We have over 200 of health professionals, patients, family members registered for session. And we always, I think we started this session like I think this year March. So after the first session, we always get a lot of requests to continue and maintaining these webinars. And this is our like 7th session already. And we think that the objective of this session is hopefully we can help patients to get to know the knowledge on how to improve their stroke condition, At the same time, also we can share some of the latest evidence, some of the knowledge for physiotherapists, OTs, doctors, and other professionals and publics as well. So thank you, Melissa. So Melissa, so hi, Selena. Thank you for good afternoon. And yes, now I would like to invite Yvonne. So the floor is yours, Yvonne.
Thank you, Dr. Khor. Okay, now I'm starting to share my slide. Can you all hear me clearly? Can hear me?
Hi, if you can hear, you can just type yes in the column. You can just put yes. Thank you. Thank you, Ding. Thank you, HL. Thank you, Avini. So yep, if you face any technical issue, you can just let our admin know. You have yeah. All right. Okay.
Okay, can see my slide, everyone? Yes. Okay. Good afternoon. My name is Yvonne. I'm a senior physiotherapist and the founder from YK Natural Physio Academy. And my experience is about 8 years in physiotherapy field. So today I feel great and thanks to Dr. Khor to invite me again to share about the shoulder subluxation in stroke for today. Okay, for today our title is how to prevent and treat subluxation after stroke. Okay. As you all know, shoulder subluxation is a common post-stroke complication affecting up about 80% of the stroke patient, right? I think today's seminar is a lot of physiotherapists, occupational therapists, and also others professionals will be inside. So we know after getting stroke, many people will experience shoulder subluxation, and they come to a lot of questions how to treat shoulder subluxation. Before we treat subluxation, what is okay, so shoulder subluxation is defined as a partial or incomplete dislocation that usually stem from changes in the mechanical integrity of the joint. You can see the first picture here. This is the natural position of the shoulder joint, right? So for your surrounding or your patient or yourself is a stroke, so you can see have this kind of symptom. You can see for the second photo, which is muscle is weak, can't support the shoulder joint. Okay, that is called we call shoulder subluxation. Okay. Okay. Why subluxation of shoulder need to be treated? I treat a lot of patients. Some they experience shoulder subluxation in stroke, but they don't want to bother it. They feel it's enough. That is not right for the patient because shoulder subluxation shouldn't be treated. You will experience a lot of things. For example, shoulder pain. Second, to improve the muscle strength of the hand. If shoulder experience subluxation, there is a very hard to improve the shoulder muscle strength. Okay, and then if you treat if you have the shoulder subluxation, you also will disturb the hand recovery in stroke. Then to avoid the disability of the hand, to avoid neck and back pain because of the compensation due to the subluxation of the shoulder, and also to increase the functional activities of the hand. That's why shoulder subluxation must be treated after the stroke. Okay, now come to how to treat shoulder subluxation in stroke. First thing, no matter you are physiotherapist, occupational therapist, or you are patient which is experienced stroke or with the shoulder subluxation, first thing you can do is assess the shoulder subluxation. After assessing, you know is how the serious on your shoulder subluxation, then you start to treat. How is it? First thing you need to do is positioning. Second, shoulder bracing or sling or wearing a sling. And last one is the weight-bearing exercise. So what I mentioned here, patients who have stroke also with the shoulder subluxation can do at home. Okay. Okay, how to assess the shoulder subluxation? This one you all can see the photo here. First thing, you need to use fingers to measure the grade of the subluxation by placing it below the bony prominence on the lateral side of your shoulder without any support on the arm. You all see the first photo. To measure the subluxation of in the shoulder, you all cannot support the arm on the chair. Okay, when the patient sitting on the chair cannot support his arm. Okay, then you use your finger as a photo. Second photo, you see, use the finger and then place before not before, it's after the bone. Then you see, checking, is it one finger, two finger, or three finger? Okay, so this one can help you to assess the shoulder subluxation. Then it can divide it to 6 grades. 0 grade is no subluxation. Grade 1, half finger brief gap. Second grade is a 1 finger brief gap. Then grade 3, grade 4, and grade 5. Okay. Then you can progress the patient, or you are caregiver. You also can help your family members who are experience the shoulder subluxation in stroke. Also can help to assess by using this method. Okay, just now I say from the graph. Second thing, after you know, okay, the patient have subluxation in shoulder, what you need to do is hand positioning. What is hand positioning? Okay, hand positioning is a correct positioning at an earlier stage, which can promote body awareness, prevent shoulder subluxation, and reduce tone spasticity. Okay, this is also based on the research in 2015. You can see the picture below. Okay, first thing, need to support. When the patient lie on supine lying, that means lie on the back. Okay, the hand need to be open out, again the spasticity, and the hand need to open up. This will reduce the stress on the shoulder joint. Second, when patient is sitting, you cannot hang in the air. Okay, the shoulder need to support with the pillow. This is the important positioning if the patient just have stroke. Second, sling or brace. Sling, a lot of people say, why I want to use sling? Why I want to use shoulder brace? Actually, this is very important when you just get in the earlier stroke. Why? Because when you have an earlier stroke, the muscle tone still have a bit of the muscle tone, so it's not so flaccid. It's not so weak. That's why if you didn't support it day by day, the muscle will be start losing or decrease the tone. Then when you didn't support it correctly, one day, or you use a different way, or you pull the hand, maybe it will experience a shoulder subluxation. Okay, sling is the common sling. This one can use for the stroke patient, like a triangle sling. You can see all is hang on the neck and support by the neck. This is called sling. And then a study also showed that significant effect of using therapeutic shoulder sling in treating the subluxation of shoulder after stroke. It will be improve the treatment and the shoulder subluxation. Then second is shoulder brace. Usually shoulder brace is prescribed by professional, doctor, physiotherapist, or occupational therapist. Why? Because brace is not support by on the neck. Okay, it did not support by the neck, and it will help to assist physiotherapy treatment. For example, the second brace in the picture, second shoulder brace in the picture, you can see got one sponge in between the hand and the thorax or the chest. Why got put this? Because it will reduce the spasticity when the hand keep contacting on the chest. Okay, So at the same time, it also helps physiotherapists to reduce the muscle tone, and it will be progress faster during that treatment. So shoulder brace usually will prescribe by professional, and sling, which is patient can use by themselves. No need to prescribe by professional. Okay, now third, this is the excited part, which is physio and patient can do. Physiotherapists will be always advise patient to do weight bearing exercise. Okay, this is during physiotherapy session. How about at home? How about at home? What you can do, what exercise I can do? Since I got subluxation, my elbow cannot move, my wrist cannot move, then one exercise I can do. Yeah, this is the exercise you can do at home, which is called weight bearing exercise. You can put on the weight with the hand open, and then you bear your body weight on your hand. Okay, this one can help you to improve your joint sense as well as improve your muscle tone on your shoulder. Also prevent subluxation on your shoulder. And see from the picture, you can progress from 1 to the 3rd photo. First thing, maybe patient can do the weight bearing exercise in sitting position with hand open. Okay, then lean on the affected side. Second, if you do mat activity, you also can do weight bearing exercise on the mat. Third, which one? This one is more difficult, which is you need to put your weak hand on the wall, then you lean on it. This one quite hard. If you can't do, if your muscle tone is not so good, prefer the first photo and second photo first. Okay, until your shoulder gap is reduced. Now from 2 finger to 1 finger, you can start to use wall for your weight bearing exercise. Okay, this is come to research. Okay, people say, is it real weight bearing exercise can help for subluxation in stroke? Yes, of course. From 2003, weight bearing exercise in upper extremity help to increase muscle contraction. You can see muscle activate through the weight bearing exercise. So even though you have flexi tone or subluxation 3 finger, you still can use this method to treat subluxation in your shoulder. Okay, other than the weight bearing exercise, physiotherapists also provide electrotherapies to stimulate the muscles surrounding the shoulder joint, mobilizing the scapula to avoid muscle spasm and pain. Mobilizing the scapula is not mobilizing the shoulder, because shoulder is already weak. It didn't feel stiff. Because joint, the bone and between the bone, the gap is a gap already, so it won't stiff. But scapula, which is the stroke patient, they didn't use their affected side, right? So scapula, the back, the scapula will stick with the chest. So at the same time, you also need to mobilize the scapula to avoid any stiffness on the scapula. Then easier for the patient to move his shoulder movement. Okay, then last is the tapping. Tapping to stabilize the shoulder joint. Sometimes physiotherapists, they didn't use brace, they use tapping. Tape which muscle is weak, and then support the shoulder joint, as well as we call stimulate the muscle to make it more strength and can hold the shoulder joint. It's an awareness for the muscle to hold the shoulder joint. Other than that, today's seminar is not only for patients, it's also for physiotherapists, occupational therapists, and also other professionals. So I put this slide. Patient will ask, what is the difference? I can do exercise at home. What is the difference I can do when I go for my physio section? I can do at home also. I don't need to go for the physio or occupational section. Actually, it's not like that. You can see the exercise from this slide. You can see first thing, strengthening with a dumbbell. I think for those patients who are experienced in stroke, I don't think he can do this movement correctly, because he don't know the cool, he don't know the technique, he don't know how to stimulate the muscle to do the strengthening in the first picture. So what you need to do is you need to ask an opinion or get the advice from your professional to learn how to make this movement. After this movement, the neutral shoulder movement is already gained and recover. Now need to go back to we so-called PNF. PNF at the first we need to do assisted. Physiotherapy need to assist the patient to do PNF movement, which is help in our daily activities. Then progress to strengthening without assisted. You can see from the 3 photos here, from first to third photo, patient is learning with physiotherapist or occupational therapist guidance. That's why when to go to a physiotherapy section or occupational therapy section is needed, because what you can do at home, this is to increase the recovery on your muscle. With the help of physiotherapists or occupational therapists, you are more fast to speed up your stroke rehabilitation progress. Okay, this is a latest research which is I study in Google Scholar. You all can go to study, because I don't think one method can treat a stroke patient until to recover. So combination is important. Combination is important. And from this study, a tapping combined with a PNF exercise can help to treat subluxation, shoulder pain, as well as the upper extremity function. So you can see from that, if we combine patient exercise at home and physiotherapy section, and also occupational section, maybe it will speed up the patient recovery. Instead of 6 months, maybe 3 months. So this is my case study. Okay, this patient is after I start the Terry rehab, he's my first patient in Terry rehab, which is virtually without hands-on this patient. Okay, and then we use the above just now I present to you all the above 3 technique, and this patient is successfully from 2 finger to 1 finger without hands-on the patient. You can see the important thing. So like just now I present the slide previously, can help you at home to treat shoulder subluxation, and just use 3 months, 2 weeks once, 2 weeks one section with the Terry rehab. We can help to treat the shoulder subluxation in this patient. So we can see patient know about shoulder subluxation in stroke is very important. If they understand and the patient also cooperative and combined with physio treatment, the shoulder subluxation can be treated. Okay, everything is prevention is always better than cure, right? So before the patient who have stroke, need to prevent first after you get a stroke. For example, you can see the photo below, the 4 photo. Okay, if the patient have stroke, they will have this kind of symptom, right? You see the first photo after getting stroke, the photo from the second to first. That means the patient start to have muscle weakness around the shoulder joint, right? After that, you can see the joint gap on the shoulder. So before you get shoulder subluxation, you better to do the weight bearing exercise or wear the sling or shoulder brace in your earlier stroke. It will be help to prevent shoulder subluxation also. Some more. Here is the tips, which is how you can prevent your shoulder subluxation in stroke. First, do not pull the hand, the affected hand. This one you need to tell your family members or your patient, okay, family members who take care of the stroke patient, please be aware, do not pull on the hand. Second, sitting without elbow support. You can see the second photo. You see this auntie sitting with the shoulder is hanging, right? So you can see this one need to be avoided. Okay, so improper positioning for the shoulder patient, for the stroke patient will cause them have the shoulder subluxation. Okay, then third, do not overstretch your shoulder. Do not overstretch your shoulder. For stroke patient, the shoulder joint is weak. Their sense is maybe don't have the sensation. So you overstretch, they don't know that one is overstretched. So this will high risk let them to get the shoulder subluxation. For example, stretching for the shoulder may need to be avoided until the muscle tone is increased. Then you can try to reduce stretching. Okay. Get suitable home exercise and guidance on how to perform this correctly from a therapist. Of course, correct exercise from a professional is needed. Without, like, for example, some patient, I think after getting stroke, they can go up to YouTube and then search, exercise for stroke. This one can do, this one cannot do. Actually, it's not a proper guide for a patient because different stroke patients have different condition and situation. So you need to get advice and assessed by a professional physio or occupational therapist or doctor, then you can follow their exercise. This is a good way to prevent shoulder subluxation. For example, like just now, overstretch. If you see some patients, they have the stroke in a spasticity condition. So they do stretching. But your case is spasticity, but you do stretching. This will make worse on the situation. Okay? Okay, end up for today's presentation. Thank you.
All right. Thank you very much, Yvonne. Thank you for the information, very useful. And it's amazing to see that you're able to treat, you share about the patient without meeting the patient themselves. And like 3 months, you're able to like see some progress from 2 fingers to like basically improving the 1 grade. And then the patient is like, how long already the patient is like, how many years already having that condition?
2 to 3 years.
2 to 3 years. Okay.
Patient.
I see. Great, thank you. So I have a few questions in the chat box here. I think mostly is coming from a physiotherapist. Maybe I start from a simple question coming from patient point of view. So Yvonne, you mentioned about can we do the exercise at home? We cannot, like, we know a lot of exercise in YouTube, right? And actually, let's say patient we can actually do by ourselves at home. Why we need to like go for physiotherapy? Because the exercise looks like very simple and it seems like I can do by myself at home. Why should we get advice from a therapist and the guidance? Why is important, Yvonne?
Okay, we go back to this weight bearing picture. See, from the weight bearing, you see the first photo, the finger is pointing laterally. If the patient do it not correct, for example, the hand is pointing frontly, it maybe will cause subluxation on the shoulder. Right, so you can see this is a precise thing on the exercise and patient does not notice. So if they do that, maybe keep on doing, then they will feel why my head of the humerus will at the front. So this is very important. If the exercise is not prescribed by the physiotherapist or occupational therapist, maybe they need to ask advice from them or need to avoid to do.
All right, thank you, Yvonne. Yes, so it's very important for us to know that exercise seems simple, but actually it may not be suitable for our current situation. So it's very important for us to get advice from physios to know to do the right exercise. All right, I will move on to more a technical question in the chat box. So the first one is, may I know the reference from the grading of the subluxation? What is the name of the grading system? The coming from Regina? What is the name of the grading system, Yvonne?
Okay, the grading system you can check from the Physio Plus website. Okay,
Mhm.
usually they will call the finger breath assessment for the subluxation shoulder. So you
Oh.
can type from the internet, type the grading for physiotherapists in the shoulder subluxation. They will come up. In the Physio Plus, they have a grading.
All right, great, thank you. I think Yvonne, you also mentioned inside your slide, there is a name on that. Okay, I move on to the second question. If coming from Jane, if subluxation does occur, is it okay to do active assisted exercise?
Active assisted exercise is yes, it's suitable, but I maybe prefer to do in maybe lying down on a supine position or in close change to improve more sense of the shoulder. And if active assisted by therapists, it's okay. If the patient doing by themselves, you need to see, don't overstretch it. If overstretch it, it will cause subluxation. Did I answer the question?
Okay, so to summarize, like is we can do with assisted training. Just we need to look at the joint, make sure we don't overstretch it, and then is it
because shoulder, for example, inflection is 180 degree. You don't more than 190 degree because the capsule is weak, the muscle is weak. It maybe will cause subluxation.
I see. So it's not to over 180 degree, so that to within the safe range is good. All right. Okay. Jane, feel free to let us know if we did not answer fully. You can just open your mic and then you can join the discussion if you need. All right. I move on to the next question is coming from Irene Yusuf. What muscle that we need to emphasize for muscle stimulation using electrotherapy?
Okay, usually we will, for electromodality, I think we're more targeted superficial or good muscle. For example, shoulder, the superficial muscle is deltoid anteriorly, deltoid posteriorly, and deltoid laterally. So we maybe can focus on that. Actually, at the same time, we got electromodality also will improve the blood circulation over there and then give an awareness on the muscle. So at the same time, you also can improve the muscle strength. Did I answer the question? Okay,
so focusing on the deltoids and a few muscles that you mentioned just now. Okay. All right, I will move on to the next. Irene, feel free to let us know if you have any other question as well. Thank you. And right, Sri, may I know which PNF pattern will be suitable for shoulder subluxation and what kinds of functional activities that we can combine while treating the patient? Coming from Sri, I think from physio as well, OT or PT.
As we know, PNF pattern, we got D1, D2, and then so we got 4 pattern, right? You can see like, for example, we do D1, maybe it's for eating. Eating is the first thing we need to learn the pattern. So you can, after train the patient with D1, you can train the patient to, for example, take the thing to the mouth. This is how you combine the treatment in the PNF with functional activities. Okay.
Okay, understand. So the next one, move on to Regina. From your experience, is higher grade or subluxation can be improved? What is the success like? Very interesting question. So basically, if it is like very serious, is it possible, Yvonne?
Okay, if very serious, for example, like here the grade maybe more than 3 finger.
Okay.
The capsule, the muscle, or some tendon inside is torn. No more intact. That is not. It's, I think, impossible for this kind of patient to get recover. So maybe surgery is another solution for them.
I see. So it still can recover, just maybe using physio exercise may be a bit tough. So maybe may need to look for a doctor in order to do the surgery, right? So it means like if it is grading from 1 to 3, basically physio exercise, we can actually recover from it. Am I correct?
Yeah.
All right. Thank you, Yvonne. All right. what is the differences of this is from Azru. What is the differences of subluxation versus dislocate? Can physio trace by palpation for this both condition? Yes, I think Yvonne, you mentioned you can use the palpation to oh sorry, what is the difference of sublux and dislocate? Can we trace, can physio trace using palpation, Yvonne?
This one, I think for experienced physio, yes, they can trace. Because why? Dislocation, which is it out of the muscle and tendon alignment, as we see, it's out of that. Then you can say that one is dislocation. For example, like here, the grade is until grade 3, 2.5, maybe 3. More than 3, that one consider dislocation. So that is the difference from that. You can see from the grade is grade 5, right? 2.5 finger gap. So it's more than that is considered dislocation. Is it answer your question?
I think, you know, one thing you remind me is you mentioned grade 4 actually from your case study, the patient that you have actually is 2 finger break gap and you reduce the 2 finger break gap to 1. So does it mean like physio is still helpful even though like more serious cases?
Because the patient, they don't know the information, what is shoulder subluxation and how to prevent and how to treat. But you advise them, that one is a physio advisor. So of course, thanks to their family, still cooperate with us, as well as also cooperative. If not, the patient won't getting well.
Understand. So it's also very important as a caregiver, also very important as a support member during the recovery. So you give the advice and then physio, family members, they really helping the patient to do correctly. Am I correct? Understand. Yes. Thank you, Yvonne. So the second question from Azru, how long the shoulder brace and support can be used at one time? How long it takes, how long we need to wear it? Okay.
I think whenever the patient doesn't support the arm, so that one need to be used. Didn't mention how long. As long as patient standing, maybe stand for a long time or sitting for a long time, the patient won't find the armrest on the chair to support it, then you need to let the patient to wear it.
Need to let the patient to wear it. Understand.
All the time lah.
How about sleeping? Is it suitable to wear while sleeping or? Oh,
actually not suitable wear on the sleeping.
Okay. So while sleeping is like you mentioned, the positioning is important, is it?
For example, the brace, this one. Last photo, you maybe can use for sleeping. You need to see the type of brace. For the sling, is not suitable when you wear it on sleeping. Like for example, the brace for the last one, we can wear it because some patients, they are not aware or is not cooperative. They do not understand what they are doing, so you need to wear it.
So Yvonne, while talking on this, I saw there's a lot of different types, and I understand that this may be for different condition, right? And let's say if I'm patient, I have a shoulder subluxation, and I'm wearing I wearing a brace. I saw somewhere and then I wear it. How to know that what I'm wearing the correct brace that's suitable for my condition? Is that indication or symptom that I need to look at whether this brace is suitable for me?
This one is depend on patient condition. Some patients, they have spasticity. For example, the shoulder also spasticity. The one is not suitable for a brace.
Okay.
Because the positioning of the brace, when you wear it, then maybe the positioning of the brace is go front. Like the sling, it go front. For example, it go front. So patient already have the spasticity. I don't think the brace is necessary for this kind of patient.
I see. So it still need the kind of like consult with a physiotherapist to do the right one.
Yeah, if the patient, they know they don't have physiotherapy advice, maybe in daytime, during daytime, sling is the suitable assisted sling for them.
So let's say if I'm wearing correctly, I will feel comfortable, or I need to look at if any pain, I need to stop, or how is it?
Usually wearing a sling, no shoulder pain, but got neck pain.
Is it considered normal?
Yes, considered normal.
All right, thank you, Yvonne. So, but is as a safety concern is let's say if you are having subluxation, it's actually very important to, if possible, get a consultation with physio so that they can advise what is the right brace for you. That is the safest case. Am I correct, Yvonne?
Yeah.
Right. Okay. So the third question for Abdul, can Rome exercise prescribed for patient with shoulder sublux? If yes, is there any specific range to tolerate? If can't, how to prevent stiffness, contracture, limit joint play at glenohumerus joint?
Okay. I think if contracture or stiffness happen, usually the patient have the subluxation, maybe one finger. Usually more than one finger, they don't have the contracture. As elbow or wrist. Okay, this type of patient, yes, RM can be prescribed. RM exercise can be prescribed for this kind of patient with shoulder sublux. But just now I mentioned, don't over the full range of the patient.
Don't over the full range. Okay.
Full range, it will may cause subluxation more serious. Right. For example, I say if the patient has subluxation, but the elbow is contracture or maybe spasticity. I do the RM, I cannot with the straight hand, right? I think certain limit, not until 180. I think I can done within 180 only. But if I insist need to do until up, it will cause the muscle more weaker on the shoulder. So don't over the, we call the full range of the shoulder joint. Then should be all right.
All right. Thank you, Yvonne. Regarding on this question, actually, I have a lot of questions as well here. I have another question is shoulder subluxation same as dislocation or not? And how to know whether, that's how you mentioned, it maybe need an experience to know the differences, but is both can be treated by physio, especially like layman or caregiver? I mean, let's say if they have a subluxation, dislocation, is it both can be treated with physio or yeah?
I think dislocation for dislocation, some they do MRI. If you are our palpation skill not so good, if we do MRI, we can see the ligament or the muscle, which muscle still intact. For shoulder joint, if the rotator cuff muscle still intact, maybe it can be treated by physio in stroke, not in MS, not in musculoskeletal shoulder dislocation. I mean in stroke, because in stroke, patient don't have the muscle tone on the shoulder joint. Even though you're after surgery, is it the patient will gain back the muscle tone? This is very subjective. So if dislocation is not so serious, the muscle, the tendon, the capsule all is still intact, I think doctor also will use conventional technique. There may be casting or sling or on the brace, then let the physio to treat them. If tendon, or if you're from the MRI result, you come up, maybe the supraspinatus is tear. Okay lah. If torn, how to hold it? The shoulder joint can't. It can't hold it because the muscle is don't have over there to hold the humerus go up. So this one maybe need surgery. This one still need our MRI or radiographer to interpret for us. Okay.
Okay. Thank you, Yvonne. So beside, so you mentioned there is another question is let me see. Beside physio, how to cure shoulder subluxation? I think this is coming from a patient point of view. So means you mentioned about a lot of physio exercise. Is there any other ways that beside physios, what else? You mentioned about surgery, yes. Is there any other things that you think we should know?
For the subluxation?
Yes, correct. How to cure shoulder subluxation?
Subluxation, as just now today's slide, you can see a lot of methods you can use. For example, to stimulate the muscle tone is a one technique. The weight bearing exercise is one technique. PNF is a one technique. Strengthening is one technique. So actually for patient, you need to assess. Maybe you do for 2 weeks treatment, you need to assess. Is it this treatment suitable for this patient.
Mhm.
So assessment is very important. No matter is physio or patient themselves, they need to know how serious their condition. Then they only can use the correct method for them.
Understand. So Yvonne, that means the main treatment actually is physio. I mean, the main treatment is actually physiotherapy trainings, right? So there's no way like medication I can recover from it. So just coming from a layman term from patient, maybe sometimes we may want to have a magic pill we can recover. So what you're trying to say is it the must do exercise actually is today you share about physio exercise. We need to use exercise to regain to help to treat the subluxation. Am I correct?
Because this is a physically, it's not internally.
Understood.
You need to use screw or your hammer to do it. Like a table, you need to use hammer. You cannot put or inject some water inside. Is it the table will be fixed? I don't think so lah. You need to use hammer and screw. This is an example.
Understand. So maybe this is a very good information whereby if related to mechanicals, like in our human body mechanicals injuries or like disorder, we definitely will need to look for physiotherapy or occupation therapies. But let's say if our bodies, our blood pressures, our clothes and all this, and we will definitely need to go for the doctors, right?
Yeah.
Understand. Thank you very much, Yvonne. Right. I have one question from Jane. The patient complained of pain around the wrist, not unclear what kind of pain because of speech limitation. Could that be due to nerve impairment from shoulder subluxation? And how to help to reduce the pain? Very very technical. Very technical question. Yeah.
As for me, if this is my patient, I will check how to check. For example, patient due to pain maybe muscle weak. Muscle weak is one thing. Joint pain is one thing, right? Joint pain, muscle weak, or nerve. So maybe for the shoulder subluxation, if this patient has shoulder subluxation, we need to do is maybe weight bearing. Weight bearing, like just follow this 3 photo, maybe try. Then after that, ask the patient, the pain got decreased or not? Just not the head. If the patient got decreased and not the head, that means it's a shoulder subluxation caused this type of pain. Okay, if you know, then you need to maybe as a MS case, you need to treat the neck because they can compensate their body due to the stroke. And then neck maybe your impingement the nerve, then you need to treat the neck. So either way, these two ways you can try.
Okay, all right. Is another question is treatment of subluxation in elderly patient same as adult patient? Yvonne, this is coming from page physios, I think.
Elderly than adult. If in stroke, I think adult is more concerned and more understanding what we're doing because they have education background, everything. For elderly, maybe they don't understand. That time, where is the sling and the brace play the important role in this kind of situation, right? Because elderly, why I want to do this? Where is my pain only? I make me pain, but they don't understand it. Then okay, never mind. I do during my physio session. So when you're at home, you just wear this, right? Just wearing at the time, okay? Then other thing you don't need to do. Can put more physio section for them, because understanding what we are saying.
So what you're trying to say is actually is the exercise is not like fixed for everyone, and it really depends on the age, the condition, their environment, their motivation, as well as really depends on and some exercise maybe not suitable for that patient, is it?
Because I think can come to today's seminar, I think they are more education background, understanding what's that.
Sure.
So of course you do the weight bearing exercise, they will cause shoulder pain because so long already they didn't the joint get to let the bone and the bone intact or touch together. Of course, it will cause pain when you do weight bearing exercise. That's normal. So what you need to do, cure the pain of joint pain because of the weight bearing exercise. You just put the ice pack, cold pack, or hot pack. This is you can decide by physio lah, or maybe just start you need to put Khor back because due to the cartilage inflammation.
Understand. All right, thank you, Yvonne. We still have 5 minutes and I have a few more questions left here. Is kinesiology taping is prevention or treatment for subluxation?
Where is the title?
Is in my question list.
Okay. Okay, taping. I think in physio field we see a lot of brand on the tape, right? Got grippy tape, got China tape. This one need to be careful when you choose the tape. Of course, the taping will help to improve the subluxation, but the sticky and the chemical on the tape, it may cause another complication on the patient. For example, skin, because for elderly, skin is more dry. When you use the tape, maybe you cannot pull too long, or maybe you can pull a little bit to make the elastic still there. Then the patient won't have the erosion on the skin, okay, when they do the movement. Tape, I feel, is very suitable for stroke kind patient. Just you need to choose the type of the tape. If for patients who are allergic, then too sad, they cannot use the tape.
Okay, all right. So it can be for prevention and treatment as well, right? For taping, understand. And it's important to get the right brands suitable for safety, understand. All right. And this is how about pulley exercise? Is it pulley exercise recommended for stroke patient?
I think in my second webinar, I got mentioned that pulley need to be very careful for those patients who have flexibility. Okay, because pulley, right? Pulley, unique sense, or if not, the patient can use the active side to pull without maybe overstretch. They also don't know. Cause subluxation, right? So pulley, you need to check patient shoulder have movement. If got movement, then they can use the pulley because they will use the muscles on the affected side. They have sensation on the affected side. If they have subluxation and then can't move, you make the pulley. Actually, what is the purpose for the pulley use? Pulley is need to reduce the stiffness of the shoulder joint. Just now I say shoulder joint, if you have subluxation, they had to have contraction contracture on the shoulder joint, right? So be careful on this.
Understand. So it's very important, like mentioned. Actually, there's a lot, thousands of exercise online, and but very important is always to get the advice from your physios to know whether this is suitable for your current condition. It may progress, may be suitable for later stage, maybe not at the moment based on your current situation. All right, great. Thank you, Yvonne. The next one would be coming from Hamza. Do you think that supporting the subscapularis muscle or deltoid more is affecting the subluxation gap to reduce?
Okay. This one is affecting
more effective. I think more effective, is it? More effective to strengthen, support which muscle?
I think this one is depend.
Okay.
Because shoulder subluxation maybe is caused by all muscle or not just one muscle on the shoulder. For me, yes, of course, the deltoid is very important. And subscapularis is also important. If the both muscle can't work, I don't think the subluxation can be cured. So both also need to activate.
Understand. All right. So another question is how to strengthen deltoid muscle, Yvonne?
How to strengthen deltoid muscle?
I mean, this is is that what kind of exercise normally you use for deltoid strengthen?
Okay, we need to know deltoid. Deltoid is from where? If like we for example, abduction. Is it from 0 to 30 degree? Right. From 30 to 90 is the deltoid muscle, right? So you need to train on the range.
Understand.
Muscle will play the role in different range of the movement. So you which deltoid you need to strengthening. For example, anterior deltoid is for flexion. For abduction, then posterior deltoid for extension, right? So see what movement you need to train, then you can accordingly to train it.
All right, thank you, Yvonne. Yeah, if we will do weight bearing exercise, minimum how long we should do it? Minimum how long? Like, I think you mentioned a few.
Yeah, I mentioned
like how many exercise is it? I think like how many repetition, or for example.
Okay, for I think we got previously I got a slide, presentation slide in the previous section. Bearing exercise to reduce the spasticity is about 10 minutes. Do the weight bearing, one exercise only, the weight bearing exercise for 10 minutes is able to reduce the spasticity as well as giving joint sense. So 10 minutes is a good answer for you treating patient. But maybe some patient not even 10 minutes, maybe 10 seconds they feel pain. You can divide until accumulate to 10 minutes.
Understand. I have 1 more minute left, so thank you very much. I think we have answered all the questions here, and I think admin can share the feedback form while you can fill up the feedback based on the current today's session, and then inside the form you can actually fill up if you want the e-certificate, let's say for your documentation or for your other usage. You can fill up that, and then you will get the make sure to key in the correct email address, and then you will get the email the certificate for you. All right, and I think thank you very much, Yvonne. We have a lot of questions today, very packed session, and thank you very much. So I think it's really great to have today. We still have like 106 participants in the Zoom session today, and well, we will continue to do this session, and basically the objective is we want to update everyone about maybe how we can use technologies, and then another session is how is the latest some of the updates maybe in the physiotherapy and knowledge, and we hope that we can share useful information with all of you. And at the same time, actually, we are also looking for as a Techcare, we getting more and more patients coming in, and we actually looking for more OTs to join us and helping patient tally to do them, and also speech physios. And let's say if you are stroke doctors, we also hope that we can work together how we can help the community using different approach, technology plus online. And you can, as you can see, Yvonne actually one of the pioneer teletherapists on board with Techcare, and helping patient without meeting them, also able to help the patient. And for therapists, well, we hope that this session actually can help to add some of the value for your practice. And yeah, we will feel free to feedback in the session, and if you would like to have any topics in the future, you can put it in your feedback form. All right, and yeah, if let's say if you also have you think you want to become want to share something, and you feel free to email us, and then we can consider as well to be a speaker as well, right? So and I think that's all. We will leave it here for 3 more minutes. All of you can have the times to fill up. Thank you very much, Lee. Thank you, Melissa. Thank you for joining us today, and thank you, Yvonne. All right, I wish everyone have a good day, and we will stay until 10 more minutes for if you need the fill up the feedback form. All right, thank you, Yvonne, and I wish everyone have a good day and stay safe.